Hello, my name is Albert McLeod. I'm with the Village Lab podcast group, and today we are going to be coordinating this podcast around various topics around HIV and harm reduction and also around Indigenous community health. We are here to amplify voices, share knowledge, and build healthier communities. So I encourage listeners to follow along, rate our podcast, or share the podcast with other people who may be interested. In today's episode, we are diving into a topic that is sparking both debate and deep advocacy: harm reduction. Harm reduction is approach evidence-based care. It recognizes that people use substances for many reasons and that legal or abstinence-only models don't work for everyone. Instead of judgment, harm reduction meets people where they are at, offering tools and services that reduce risks associated with drug use in this case. Things like safer consumption sites, needle distribution programs, access to naloxone, and mental and social and spiritual support. But despite its success in saving lives, harm reduction approaches are affected by myths and half-truths, intense criticism, and political pushback. Today we'll be unpacking what harm reduction really means, why it matters to Manitobans, and the real-world impact of legislation and policies that either support or dismantle these life-saving services. Joining us for this conversation is Jonny Mexico from the Manitoba Harm Reduction Network and Melissa Morris, a harm reduction advocate with lived experience. Let's get into it. To kick things off, we'd love to hear about your journeys. For our audience who may be new to you and harm reduction work, could you share a bit about you, who you are, and what has shaped your advocacy efforts regarding harm reduction? Jonny?
Hi, everybody. My name is Jonny Mexico. I am an uninvited settler to these lands. I am a coordinator from the Winnipeg Harm Reduction Network. With the Harm Reduction Network is comprised of harm reductionists from agencies, organizations. We all come together to move harm reduction initiatives forward. And I've been doing this work with the Harm Reduction Network for about 4 years, but I've been involved in harm reduction work specifically for about 25 years, formally and informally. A little bit about who I am. I am someone who actively uses illegal and illicit substances and has for over 25 years. My first experiences of using harm reduction practices in my life was, again, about 25 years ago when I was living in East Vancouver, BC, when my partner overdosed while I was sleeping. I realized I woke up to gurgling and I looked over and they were blue. I started to do CPR, rescue breaths, chest compressions. I called 911, and in that call, I remember specifically from people who used substances at that time to never say that this was an overdose, but to say that the person was non-responsive or that we thought that they were choking. So what I said was my partner was non-responsive, and that meant the paramedics showed up without the police. They were able to administer naloxone, and my partner survived. And that is like the first real experience I had with harm reduction and how important it is in the ways that systems work and how to navigate things and how connected it is to peer knowledge. So that's a little bit about me. I'll kick it over to Melissa.
Thanks, Jonny and Albert. So I'm Melissa Morris. I'm the manager at the Village Lab. I'm also a person that used intravenous drugs for over a decade. I lived in Vancouver's downtown east side for over a decade, and I experienced, the drug use and the death that, came from that to a lot of my kin. But I also experienced Canada's first safe injection site in Vancouver, and the care around harm reduction and how that can impact communities.
Thank you. Manitoba has been involved in harm reduction, particularly to injection drug use, going back to 1989. So it's not something new in Manitoba. And certainly it is something supported by our provincial government, our health departments in understanding, providing harm reduction supplies to, people who are using drugs. What are some of the misconceptions today about harm reduction in Manitoba. Jonny.
So my thoughts on resistance to harm reduction. I think first let's hit that one. And one of the ones that we hear quite a lot is that harm reduction is enabling drug use. That narrative is really tired. And I want to use a quote from one of the peers that I get to work alongside. And I remember them saying this at meetings and in different interviews. And what she had said, we are not enabling drug use, we are acknowledging drug use. And that is such a key difference, because at the core, it acknowledges the things that people do. It acknowledges and celebrates people's autonomy, providing folks with information so that they can make the most informed decisions based on whatever's going on with them at the time. And this can look like all sorts of different things. It can be like getting your drugs tested so that you know what's in them and can make a choice, an informed decision about how and what to use and the route to use. And I'll tell a personal story here. I had gone and got my, one time I went and got my drugs tested. I was using a stimulant, and I found that it had a lot of fentanyl in it. And in that, I want to recognize that I have a lot of privilege in my drug use. So I was able to just decide not to use it and go and find something else and get it tested, and it had what I needed in it. If I had not got that tested, I would have overdosed. And if I was not in a supervised consumption site or an overdose prevention site, I would have likely have died. So that is like at that core, that is the tools to give people all the information they need to make the best decisions. And I'll tell another story. Another time I was getting my drugs tested, only to find out that there was absolutely no drugs in what I was getting tested. In a nutshell, there were two things that were in it. One was something that was a skin irritant, and the other one was a stool softener. And so I tossed it out and went and found something else. So again, it gave me the tools and the agency to make a really solid and informed decision. And I think that those are the big misconceptions. Other misconceptions around the closures of supervised consumption sites in Ontario and Alberta. I believe that there's currently a Section 7 charter challenge around that. Section 7 in the charter guarantees the rights to liberties and security of persons, except for in accordance with the principles of fundamental justice. This was the section challenge that was super successful when Canada's first supervised consumption site, as Melissa mentioned earlier, Insight, was under threat of closure, and that was a successful challenge that enabled it to remain open.
Can you talk a little bit about how safe consumption sites get that legal representation to be able to create that environment where people can use drugs?
For sure, Albert. Yeah, in order for supervised consumption sites to operate legally, as well as drug testing, the agencies need to apply for an exemption to the Controlled Substance Act. And it's a very arduous and lengthy application process. I know of organizations that have worked years on their application. It does take a long time. There's a lot of detail that needs to go into it, and rightfully so. But it's interesting because it also shows the barriers in accessing this. Like, we shouldn't have to wait a year for an exemption to be finished, for an application to be finished in order to address the toxic drug poisoning crisis that we're in now. There should be different mechanisms, different supports for agencies and organizations to help support to get through this application process in a much quicker, more direct fashion. So
that exemption comes from the federal government, right? And that sort of supersedes provincial and territorial barriers.
That is correct. Yeah, that's absolutely correct. That exemption comes from the federal government, and it provides protections against simple possession in these locations.
Yeah. Now, I noticed during COVID-19 pandemic that some of the essential items that were covered in Manitoba were alcohol and cannabis use, and that to me is an example of harm reduction, because people do use substances, and so that's an example. Even recently, where governments did support harm reduction. In this case, it was enabling people to have access to alcohol and cannabis, which is illegal in Manitoba. Now, Melissa, we are getting a safe consumption site in Winnipeg. What happens at a safe consumption site, and What would this mean for our community and for people who rely on harm reduction services?
Thanks, Albert. So right now, we'll go back to misconceptions for a minute, and the misconception against the soon to be harm reduction safe injection site is that it's going to bring people to their doorsteps. In reality, people are already using drugs in these places, right? What a safe injection site and safe consumption site is doing is bringing people into a safe place where they're closely watched. And I think with the toxic drug crisis that we're currently in, these types of supports are so needed. Whereas, people are dying alone on the street. And these are human beings, and that's not right. Right. What safe injection and consumption sites also do is they provide you the connection to people. They provide you the connection to safe supports. They provide you connection to workers that can provide supports with housing. And maybe if that person decides that drug use isn't for them anymore, then they will also have the autonomy to decide that and discuss that with somebody through services available through a safe injection and consumption site. So I think, what the impact is for the communities is that people aren't going to be dying on the street alone anymore. People will be safe. They'll have a safe place to go no matter what decision they make in life. And, using drugs does not make somebody a bad person. They're not necessarily, drug users get laid criminals all the time. They're not, right? And I think, that rhetoric, like Johnny said, is getting old, right? We're done. We just need to help our people, and a safe injection site is going to benefit the community all around.
If
Yeah, and
if
I think, oh, go ahead, Johnny.
Yeah, just to build a little bit on what Melissa said there, I think that's like having a really good discussion around supervised consumption sites really hits on a lot of the different things that harm reduction is, right? Harm reduction is dismantling systems of oppression, dismantling bad policy, working with peers. Like it's all of these things, working with people who use substances and having those folks at the forefront of all of these discussions. And people who use substances have said continually, decades after decade, these things save our lives. These things are what we need, right? There's other things that people need too. They need housing, they need access to medical attention and so forth. But the other things that supervised consumption sites do is that they disrupt the spread of STBBIs. So they'll disrupt the spread of HIV. It'll disrupt the spread of Hep C, which in our province is skyrocketing. And these types of places provide folks with sterile injection equipment, sterile snorting equipment, provide folks with access to condoms and information on what's going on, information on getting tested, all of these kinds of things. And we want to talk about, if we're wanting to talk to people who are more conservative than us, or I'm going to air quotes here, fiscally responsible air quotes, to interrupt one HIV transmission saves the province approximately $1 million, give or take, in treatment for that individual. And I'm not suggesting that the individual shouldn't be treated. I'm suggesting that by having these things in place, we're able to disrupt these things. We're able to save costs to our healthcare. We're able to save spaces in our healthcare system for folks who are needing services. So I think there's a lot of benefit, as Melissa says. There's these wraparound systems and community support systems that are in place there. But I think we also need to talk too about the way the people become connected and the ways that relationships are built in these spaces, and how delicate and precious and important those are to folks that work in there, as well as for folks that come and utilize the service and form community in these spaces.
Yeah, and I think, the loss to, people who overdose because of the toxic drug supply and pass away. Manitoba is no exception to the risks associated with the toxic drug supply. In 2023, Manitoba reached an all-time high of 445 deaths, up from 418 the previous year. The most recent information we have for 2024 is up to and including July, and in that time there were already 323 deaths recorded. making us on track to have more deaths than any previous year. So I think in terms of the impact on communities, families, loved ones, this is really an urgent issue for Manitobans and people, especially in Winnipeg, where the safe consumption site is going to be. Really, we need to understand that, when someone passes away suddenly and unpredictably, it does cause, trauma in the community. And as Manitobans and Winnipeggers, we really need to be aware of that and conscious of that, that in most cases, these are preventable situations where people could go on, living and, being supports to their family members. So, in terms of the overdose deaths, is there any sort of strategies beyond the safe consumption site that people can look at in terms of their drug use?
Melissa, do you have any thoughts on that one? I've got some to share, but I'll wait for you.
Yeah, so I think keep accessing supports like MOPS. Um, find support. There's lots of different places, but I really, I kind of want to hear from Johnny on this because, my main focus is really working with people living with HIV and STBBI. And even though, I have a lot of experience in harm reduction, I'm really interested in what Johnny has to say.
Okay, for sure. So one of the things that I think about, I've attended several. So for folks that might not know, MOPS is the mobile overdose prevention site that we have here in Winnipeg. It's a RV that is beautifully decked out with a wonderful mural on the side, and when you walk into that space, it feels like you're in somebody's living room or kitchen. There's art around. It's very low barrier, easy threshold, very comfortable to come in and sit and get your drugs tested or to use substances in that space. And one of the things that it's a hidden figure. It's a hard thing to prove, but we know anecdotally that these types of services do reduce deaths because people aren't rushed when they're using their substances. They can do a little bit. They don't have to do the whole lot because they're worried about the police coming around the corner or whatever. So folks can sit. Do things slowly, controlled, in a safe and sanitized environment. And that is really key. That is a huge strategy in reducing death. Is providing spaces where people can use substances and use them in a way that makes sense for them. The other things that could be done around drug use deaths are a little bit more aggressive down the stream, such as decriminalization of substances,
Yes.
providing, yeah, like I think that is a crucial one, and that includes things like access to safe supply. Safe supply is providing medical and regulated supply of substances to folks who are using drugs through a pharmaceutical program, which makes a lot of sense because then you've got folks that are coming in, accessing their safe supply. They might be talking to individuals around what their hopes and their dreams are. There's no pressure for folks. There's constant information provided around, like, hey, if you want to talk about Suboxone, we're here for you. If you want to talk about Sublocade, we're here for you. If you want to talk about how your dose is doing, we're here for you. So there's a lot of opportunities, and we need to get really aggressive with this because this is an aggressive crisis. We are in crisis. This is as Albert said, this is preventable. And so we need to be aggressive. Yes, drug testing is wonderful. And I think it's super, super important, but it's also only currently in Manitoba available. The type of robust testing is only available in Winnipeg, and we have a lot of crisis outside of Winnipeg. Mobile overdose prevention site and supervised consumption site are great, but again, localized to Winnipeg. We need these mobile sites or different community solutions for remote and rural locations. So there's a lot of things that we can do. We need to be creative, and we need our leaders to be brave. We need our political leaders to be brave and say with their
Yeah.
whole chest that we love everybody who uses drugs, and we want safety, and we want to keep people as safe as possible.
Yeah,
Yeah.
I've taken some training with naloxone, the kit, which is very, prominent in the promotional, like on Facebook and Instagram. as sort of a resource when someone, goes unconscious or is in an overdose. And, it was only recently that we actually, in a group of elders, we opened the kit and looked at it and saw what was in it. And I think those are the little steps in terms of learning interventions around overdose situations. And again, we have to familiarize ourselves, whether you're on a plane or in a meeting or in a bus, it can happen anywhere in a public space or even at home. So, do you want to talk about the kit and what's in it, and sort of how it would be applied in a situation?
So, for the naloxone kits here in Manitoba, we have a provincial program called the Free Take Home Naloxone Program, which enables anybody who knows somebody who uses substances to get a free naloxone kit. Uh, to find out where you can get a kit, you can go to the just Google Take Home Naloxone Program Manitoba, and there will be a listing there of all the different places that you can get it. You can also get that listing at Street Connections also has a listing as to on their website as to where you can get kits. Now, in the kit in Manitoba currently, there's four ampules. I believe there's 1 milligram of naloxone in each ampule. That would be a dose, so that's one dose of naloxone. There's also 4 Banish point syringes. It's a very unique syringe. So once you've drawn the naloxone, have injected the person in the large muscle with the naloxone, you'll hear a little click and a slight vibration in the syringe, and the needle gets pulled back into the syringe, so it vanishes. It's very key to know because it can be really scary if you don't know that and think the needle broke off inside the person. So that's a very key thing to know. There's also a face shield, so that if you're needing to do rescue breaths for somebody, that's provided for you. There's some gloves and an alcohol wipe, and there's a little card. I believe there's a card around how to use naloxone and the steps around that. And so currently in Manitoba, the guideline is you would use 1 injection of naloxone into a large muscle group if somebody is not responsive. So that means they're not responding to pain stimuli. They might not be breathing, having appropriate breaths. That's 1 breath every 5 seconds. They might their heart might not be beating. So it's a really good, as Albert mentioned, it's a great tool that anybody can access and use. I've used it numerous times in a variety of settings, like Albert said, in settings in bus shacks, in my back alley. There was a time it was Christmas Day a few years ago, and there was a car that just kind of rolled down the street and parked sort of on the side. And I went out to see what that was all about. And it was somebody who had overdosed while they were driving. And I went and put the car in park and gave a shot of naloxone, and revived them. So it's a very easy tool to use. There's lots of training available for it. So when you go to get your naloxone kit, if you need a training or need a refresher, the distribution site will be able to provide that. And one of the things that's also really important to know that with the use of naloxone, it only works on opioids. So it will get rid of the opioid from the receptors, and that will enable the person to breathe. Sometimes with our toxic drug supply, there's a lot of opioids, or really strong opioids in there, and it might take those 4 shots. It might take 2 kits. And currently, when you do get your naloxone from the Take Home Naloxone program, you're provided with up to 2 kits. So that's 8 injections, and hopefully that will be enough to start somebody breathing by the time first responders arrive. So that's a little bit about the naloxone kit. I do also want to mention that with our toxic drug supply, complex overdoses are very common. And so this might mean that there's a opioids on board, there could be benzos on board, there could be a variety of different depressants on board. So you might get rid of the opioids by using that naloxone kit. The person might start to breathe, but they haven't woken up yet. And that could be that there's other things on board. So it's really important for folks who are wanting to support relatives that use substances to be familiar with what are the current drug alerts that are happening. And so here in Winnipeg and Manitoba, there's a drug alert system that Safer Sites puts out, and it lets folks know, like, hey, this is what folks have experienced, or this is what we found while we were drug testing, or hey, we just had a rash of 10 overdoses in this geographic area. Everybody be on alert. It's responding to X number of doses of naloxone, or rescue breaths were needed, things like that. So really good to stay informed and up to date with what's happening, utilizing those services that are available, and really breaking down the stigma about substance use. Every chance that you get talking about substance use, talking about how to support our relatives who use substances, and start destigmatizing by carrying an naloxone kit, carrying it on the outside of your bag if you're walking down the street, or placing it prominently when you're in a meeting, so that you can have those conversations with folks, and just starting to dismantle that stigma a little bit at a time.
Thank you. Now, in terms of harm reduction, as Jonny said, it's not just about Winnipeg. We have to look at rural, unreserved communities, northern and remote communities in Manitoba, and see, some of the opportunities, but also the challenges of harm reduction in these areas. And I know that Manitoba now has the second highest rate of HIV transmission in Canada after Saskatchewan, and I know a lot of the transmission is through shared injection drug equipment. So, Melissa, can you talk about harm reduction in this case in healing ceremonies for Indigenous people? What does that look like? And how can we make sure that people using drugs are able to access these services?
Yeah. So, I I've been working at Gani Kanichak for the past 3 years, and they really do an excellent job at making sure that people that use substances are welcome into ceremonial spaces, that they are treated as a relative, and that there's no barriers, for people that use substances to come in and partake in ceremonial things. Now, the Minnetonka Sexual Wellness Lodge is a fantastic place. They offer cedar baths to community members. And again, the belief is that, substances, if you're on substances, you can still, it doesn't make you less of a person that you can't partake in ceremony. And that's truly the belief over at the Minnetonka Sexual Wellness Lodge. So I think, we need to break down, as Jonny said, those stigmas around participating in ceremony, but also just participating in really any type of programming, and making sure that people feel included. We do monthly sharing circles for people that are living with HIV and STBBIs, and we support a wide variety of people with disabilities, but also people that use substances, and we provide a safe space for them to come, sit, and feel welcome.
Yeah, I think that that's very important, because a lot of, during COVID, a lot of services were shut down, like health clinics, drop-in clinic, walk-in clinics, and there was really, not many harm reduction supplies out there in the community. So I think we see part of that as a resurgence of HIV transmission because people just didn't have access for quite a long time, like over a couple of years. So we're sort of dealing with the impacts of COVID-19 now. Now, I know with the Manitoba Harm Reduction Network, we have a broad reach in Manitoba. So what is the landscape of harm reduction in rural communities in Manitoba, Jonny?
Yeah, so there's definitely challenges, there's opportunities, and there's some really great initiatives. And so to start talking about some of the challenges, um, so some of these things people might not think are harm reduction, but they are connected to. So one of the big one is transportation in rural and remote locations to get to things like your healthcare appointments, accessing supplies, accessing cultural activities, people keeping people connected to each other. It's really hard to do without transportation, without bus services, that type of thing. So it's one of the things that our network members, or sorry, our network coordinators in our rural and remote locations have flagged as really, really key to harm reduction promotion. Another one is housing. Housing is harm reduction. There's
Yes.
very limited and not a lot of options existing for folks who use substances or might be impacted by other systems, including lack of emergency housing in spaces. So if you don't have housing, like for example, I'm super privileged in my substance use. I can sit in my house and use substances. I can do it in a controlled way. I can start low and go slow. I can pick up the phone and call a spotting number. So that's a number that you can call and be on the phone with somebody. And if you're not responsive, they'll call emergency services to come to your house. I can do those things because I have a lot of privilege with my substance use. I have a partner that's supportive of me, and should something happen, there's multiple naloxone kits in our house here, and we're good. Somebody doing the exact same thing just outside of my house is going to get arrested by the police in a heartbeat. So housing is definitely harm reduction. And stigma is everywhere, in urban settings as well as rural and remote locations. But our colleagues in rural and remote locations talk about how it's amplified in smaller communities where everybody knows each other's business. And if you want to have a confidential and anonymous conversation with the nurse who's your aunt or your uncle, it might be really tricky. So stigma is really, really amplified. And um, again, I just really want to touch on the access to healthcare. Folks are often needing to travel for these things. Different communities are pushing back against supply distribution. There's a lot of opportunities for myth busting, for coming together as communities to address these things together. There's opportunities and people meeting around issues such as housing, around issues such as transportation. So as also, and I just want also around healthcare, there's the mobile, I think they're the mobile detox vehicles and programs that are happening in rural and remote locations as well. So there's some really innovative things that are happening with some really wonderful organizations and people doing great work out there.
Yeah, the network of the Manitoba Harm Reduction, goes from Selkirk and Portage de Prairie, Brandon, Swan River, Flin Flon, and Thompson, and they do some of this work around creating support, educating about harm reduction approaches, and I think the whole myth around distribution of syringes, and people say, well, it's kind of the chicken and the egg conversation, what came first, drug use or injection drug use or syringes. And that really is, where a lot of the backlash is centered around, harm reduction, distribution of syringes and other, drug use paraphernalia is this conversation. And from my perspective, I like to see like, when there is situations of, HIV cases, we need to consider, right, without those syringes there, those numbers could be a lot higher, right? So people really, some of that backlash is that there should not be any syringes in rural communities, and it doesn't make sense, right?
Absolutely, absolutely, and not just HIV. Like Hep C
Yeah,
is super prevalent. There's a lot of health benefit and cost saving benefit associated with supply distribution.
yeah.
Yeah.
So
So I'm
go
going to
ahead.
interrupt for a minute. I just have something to say about needle distribution, especially, and I've heard Saskatchewan has gone back to one needle distribution. And I survived through one needle distribution. And I'm telling you, it didn't really help anybody. But
Yeah,
being able to go in and get a box or a pack of 10 of needles definitely helped promote safer drug use, using clean supplies, and lessens the risk of passing on HIV and STBBIs.
yeah.
Mhm.
So I think part of the next question is around. So we talked about, Johnny, sorry, can you tell us about some of the harm reduction initiatives happening in Manitoba and Canada? And what can listeners do to get involved in these efforts and strengthen harm reduction programming in their own communities?
For sure. So, harm reduction initiatives in Manitoba, we're starting to see, as I alluded to a little bit earlier, we're starting to see robust drug testing and checking in Winnipeg. Uh, and so that's a little bit different than like testing strips. So the robust testing that I'm talking about is through something that's kind of basically a small mass spectrometer, which enables folks, the person who is getting their substances checked, to have a good idea about what is in that sample that is on the machine in that moment. So it gives them a pretty good idea about what's in their substances, and they can make these decisions. These need to obviously to be expanded into rural and remote locations, because drug use happens everywhere. Everybody deserves and should have the right to having a knowledge about what they're putting into their body. Um, we're also seeing Winnipeg, as mentioned earlier, too, has a mobile overdose prevention site, affectionately known as MOPS, which is staffed by peers and people with lived and living experience. And we need these across Manitoba in areas where they make sense for the communities to have them. We need rural and remote solutions for rural and remote situations. And so really not trying to take a Winnipeg solution and plunk it into Swan River and say, there you go. But what is the thing that's going to make sense for these different communities? Um, Winnipeg is also poised to open its first and Canada's first Indigenous-led supervised consumption site, led by Aboriginal Health and Wellness Centre, and we're really, really excited to see when that actually takes place. There's also some really great initiatives in rural and urban settings. The different mobile withdrawal management services that are available. Upscaling in that we see from the city of Winnipeg and the city and the province of Manitoba, commitments around increase to housing, these types of things we're really, really excited about. Melissa, is there anything else there that I feel like I'm missing a few things? Is there anything that comes to mind?
So yeah, I think you've covered most of them. I just yeah, I think that's good.
Oh, I
Well, I think
actually did.
the other one is the overdose community. The survivors who do the promotion. The Black Balloon Day. Who do the education and outreach about overdose deaths and supports for family members who've experienced that.
Mm.
We have Moms Stop the Harm, and then there's
Oh,
a local one here in Winnipeg and Manitoba as well, and they do a lot of outreach and advocacy around drug use. So I think that's another strategy that's happening across Canada is, the families and parents of people who've overdosed or partners who've overdosed who do that outreach and education around harm reduction.
Absolutely. That really taps into some amazing opportunities too. Like one of the things that folks who use substances are continuing to tell us too is that folks want support groups. There's lots of 12-step
mm-hmm.
support groups for folks that are wanting to go that route, but there's not much in the way of support groups for folks who use substances. There are there's different ones here in Winnipeg, but they're not there's not a big rollout of these types of things. Support groups for folks who love somebody who's using substances, and is that I think these are really crucial because these really help. I remember when my partner was using substances and had overdosed. I was in Vancouver, downtown East Side too, Melissa, and I searched everywhere for like places that like I needed support. I didn't really know how to like I didn't know how to tell my family what was going on. I didn't know how to really share with people. Again, there's that shame and stigma that just that's everywhere around this crisis.
Yeah,
And to have more supports for families and friends who are going through like how do you support somebody who's in using has problematic relationships with their substances, and how do you love somebody that I mean, I know how to do it. Like you do love somebody, but like, how do you deal with the fact that that might come in and steal your stuff because they need money to do things, and which kind of goes back to the safe supply thing. If there was safe supply that people could access, then they wouldn't
yeah,
need to engage in these other activities. So
totally.
yeah, so it's a really tricky thing, and I like I've been through it. I've felt it, and I also, from the perspective of somebody who uses substances, being able to have these conversations, with open conversations with my partner, with the people who I love and who love me, around how to support me when I use. I do wish there were more supports for folks who are in active substance use, as well as for the folks who love them.
So I totally, I want to kind of call the government to action, or whoever funds programming, because, I think there's a lot of people out there who need that support, but also a lot of people out there who will deliver that kind of support. But we need the infrastructure and the funding to be able to support, those kinds of programs.
100%.
And I think, with mandatory treatment, that's kind of the philosophy or approach that's coming out of BC, Alberta, and Ontario, for people who are using drugs, and sort of the perception that, they need to be taken into care legally, so they can, go through rehabilitation from drug use. What are your thoughts on that approach?
Yeah, so I think that's an absolutely horrid thought, to be locked up. People need autonomy, and they need to be able to make their decisions. And what if somebody's using substances, you know, where's the support? Again, going back to programming, support groups, right? Where's the support? This is deciding for people that they need to use substances. We know there's underlying issues to substance use and problematic substance use. And is locking people up the solution for that? Right? Are they going to be offering intensive wraparound trauma informed care? Probably not, because what that sounds like to me is jailing people. And we know, and I know from experience, that people who go to jail for who are using substances mostly start using substances again when they return. So it needs to really be up to people to have the autonomy to make those decisions for themselves. And we can't be going around locking people up for substance use.
Yeah, I just
Jonny?
really want to build on what Melissa says. Um, one of the dog whistles that we hear around supervised consumption site is this isn't a silver bullet thing, or whatever that is. Mandatory treatment itself is not a silver bullet either. It's a tool. Supervised consumption sites are a tool. Drug checking is a tool. Safe supply is a tool. Treatment options are tools. So to have a mandatory anything for somebody that doesn't want to go, first of all, it's putting somebody, if you're dependent on opioids, it puts you through like a horrific withdrawal. If you're also using alcohol, and have alcohol dependency, it puts you through a horrific withdrawal that you did not sign up for. You did not provide full informed consent around that. And we know there's evidence. So harm reduction is based in evidence. We know there's evidence that talks about treatment does not work like the first time around. It might not work the second or the third or the fourth or the fifth. It takes it's a lot. And again, from my own personal experience, my partner, who was a problematic substance user, went to treatment. I think during the time that we were together, 1 year went 3 times. Another year went a couple of times. Like it takes a lot of time and the right set of circumstances to support folks through it, and to have a mandatory treatment program. And I would suspect that a mandatory treatment program, when there is a wait list of people who actually want treatment to get treatment, is
Yeah,
is
that's ridiculous.
bonkers to me. So mandatory anything doesn't work. We know that. Providing supports for folks, it's also a really down the stream kind of thing. Like if folks are actually thinking about how to support, like if we want to provide environments, healthy environments, and I think this kind of gets on to what Melissa was talking about as well. The defunding of after school programs, community support programs, all sorts of activities and things, and healthcare, and the defunding of mental health has resulted in a lot of a lack of these programs for folks who could access them to do things, and to not think right now that we should start funding those things so that we keep people engaged and connected to each other. We're able to, as a community, we're able to go, hey man, I think you could use, do you want some supports with this? I see you acting in this way, or I see you struggling in this way. How can we support you? Right now, that doesn't exist.
Yeah.
I mean, there's really specialized programs. I think, Melissa, like some of the programs in the organizations that you work for, where people can access ceremony and connect in that way. But that defunding structure that has happened years and years ago and continues to happen today, to defund housing, to defund fund community programming, to defund that, and then to turn around and go, well, let's open up mandatory treatment for folks, is wild.
And I think with the Manitoba Harm Reduction Network, really historically has been working with people who we consider peers, or we use the term peers to describe them, and a lot of times we refer to them as the experts in terms of substance use. What is that relationship like with peers in Manitoba?
Melissa, do you want to? Is that one that you wanted to do, or do you want me to
Well, I can
jump in?
start on this. So I think, when we're talking about peers, we're talking about people with common shared experiences. For instance, peers is used a lot when we refer to people living with HIV, because it's a connection, that has been proven through research, to, provides, and I'm trying to find the words to explain this. It's not on the tip of my tongue right now, but it provides that connection to another person with similar or shared experiences as well. And I think in the context of Manitoba, well, we have a lot of people that share common experiences. We don't have the infrastructure a lot to be able to support them. I think, I yeah, I think the Manitoba Harm Reduction Network does a great job at bringing these people together throughout Manitoba. And with that segue, I'll pass it over to Jonny.
Yeah. Thanks, Melissa. So I would I'd just like to build on that definition of peer. One of the things, like, even though I use substances and am an active substance user myself, I wouldn't consider myself a peer because I have so much privilege. So I think one of the things that we want to do when we talk at the Harm Reduction Network, when we talk about peers, is a little different than others. We think about peers as being the folks who are most impacted by oppressive systems. So impacted by the criminal justice system, impacted by CFS, impacted by houselessness, impacted by racist systems. So we really want to take those folks and really center the voices of folks. And as Melissa said, it's really important that people that have the lived experience of going through whatever system it is that you're trying to address, guide that work, because they know best as to how that system has failed them and ways to address that.
Well, I think it's also recognizing, that substance users will want to prevent HIV transmission or Hep C transmission and overdose, right? That's sort of a core understanding of people's just uh, will, to live a good life or to be healthy, while they're using substances. And I remember years ago, I worked with a woman, and I asked her, I said, we do all this talk about harm reduction. I said, what do you do in a situation when, personally, you're in a place where there are no new syringes? And she said, well, I come over here and I get new ones. And basically, that's it in a nutshell, right? That she was the agent, she was the activist, she knew what to do, and she would do it. And that's really simply what we're asking people to do, right? And so, she was self motivated to practice harm reduction for her friends and her peers. And sometimes that's as simple as a definition of harm reduction in what we're talking about.
That's right, Albert. And I think I think too. Melissa talked about the opening of Insight, the first like sanctioned overdose prevention site. I think it is really important to understand the history of overdose prevention sites. Started way before Insight. it started with groups of folks coming together. There was a little storefront that was opened. I think it was on Blood Alley, Melissa. Correct me here if I'm wrong, but they opened up that because Insight was taking too long, and so folks came together and opened up these spaces, or groups of folks got together and had solid conversations about how they're going to party together. So peers have been doing this work way before it became sanctioned and the thing to do. Folks know what they need and they do it. And sometimes us as harm reductionists, we need to catch up a little bit and go, yep, you're right. And I also think of of the work in Albert, you mentioned too about syringe distribution. I think about before there were syringe distribution programs in the East Side, there were nurses that would take money and buy the syringes and go out and distribute them because they didn't have a budget for it. And I'm sure before that, peers were being really creative in finding ways to access syringes and so forth. So peers are very active in this work that happens right now. There's a Canadian organization, CAPUD. I wish I could remember what the acronym stands for, but it is a solid organization of people who use substances that are advocating for themselves, that are leading legal challenges, that are writing articles, that are working on destigmatizing drug use. Peers are definitely ahead of the curve as far as harm reduction work goes, and it's really important to acknowledge that historical and important work.
Yeah, in many cases, peers are trusted, in places where we may not be able to go as advocates, right, or educators or outreach workers, and they really do keep a pulse of the situation and are very resourceful and informative to us to ensure that we get supports where they're needed, whether it's in Winnipeg or in Dauphin or in Flin Flon, and I think that's really the work of the Harm Reduction Network and its facilitators in each part of Manitoba is supporting the peers on the ground where they live, where they want to live. But not everybody wants to move to Winnipeg. So really, it is supporting peers in their communities where their families are or their friends are. So, yeah, thank you for joining us today. In today's episode, we delved into the fundamentals of harm reduction, explored common misconceptions, and shared practical action items for you to consider in your own work and daily life. These conversations are so important, and we hope that we have sparked some insights and perspectives for you. We are deeply grateful to have shared this conversation with our guest, Jonny Mexico from the Manitoba Harm Reduction Network, and Melissa Morris, who is an advocate here in Winnipeg. In terms of invite our audience to share what you have heard from us, send us your thoughts or questions at Village Lab on Instagram. So in closing, Jonny and Melissa, what's your any closing comments today?
Thank Jonny. It's always a pleasure to hear your wealth of knowledge around harm reduction. And I think, if we can fight back against even a little bit of the immense stigma that happens against substance users, we've done our justice with this podcast.
Thanks.
And just to build on what Melissa had said, I invite folks to come and check out the Manitoba Harm Reduction Network webpage. We'll be able to link you to the different networks that are available in your area. So if you're interested in getting involved in harm reduction work, that's a great resource. I also encourage and invite everybody to do their part in destigmatizing substance use by checking out the free take-home naloxone program, bringing up substance use when you get a chance, talking about it at first aid meetings, health and safety meetings at your organization or where you work. Anything that you can do to start cracking open the conversation is warmly welcomed.
Thank you. Thank you both for today. And you're right, Jonny, we can have that naloxone kit on our table, but unless we open it, we're never going to know what's in there. And I think
Mm.
that's the step we're talking about. Just encouraging people to take one more step forward in understanding what harm reduction is. So thank you, everybody, and have a good day.